You know the feeling, irritated, stingy, scratchy eyes. Dry eye can be irritating, but Dallas is home to one of the few eye centers in the U.S. to have dry eye treatment centers. Dr. Jeffrey Whitman with Key-Whitman Eye Center is here to tell us all about new treatments for dry eyes. Welcome and nice to see you this morning. What are dry eyes?
Well, to understand dry eyes, we really have to understand what the tears are made of. And that tear film that sits on the surface of our eye is actually made of 3 layers. An inner mucus layer that smooths out the surface, then a watery layer to help lubricate, and on the surface is an oil layer that's secreted by the meibomian oil glands along the edge of the eyelids. And if you think about it, oil on the surface helps stop evaporation of the other layers. But if any of these layers gets out of whack, you're going to have dry eye symptoms.
So what are the common symptoms? You mentioned symptoms.
You know, the most common symptoms are, patients will come and say, Dr. Whitman, my eyes are irritated, they're itchy, burny. People look at them and say, your eyes don't look good, they look red or just inflamed. And a lot of people think, oh, I have these chronic pink eye or conjunctivitis problems.
Right.
But it's not. It's a dry eye problem. In fact, some patients even have what we call paradoxical tearing. It's so dry they pour out a watery tear. Sometimes it makes them look like they're crying. But that kind of tear doesn't help lubricate, unfortunately.
So who's usually affected?
Okay. Most commonly, we see patients that are 50 years of age and older, more female than male, and there's probably some hormonal effect there. Certainly in postmenopausal women, we see more dry eye. Certain drugs, antihistamines tend to dry the eyes out, and antidepressants as well. And those are all very commonly used today. And we have certain patients that are been wearing contact lens for a year, and these are young patients, develop dry eye and they can't wear their contacts anymore. If we can treat the dry eye, we can get them back into their contact lenses.
So what treatments are available?
Well, what we rely mostly on are tear supplement drops. And since our dry eye center can determine which layer of the tear film is causing the problem, we actually have proprietary drops at Key-Whitman that can address the specific problem and get the eyes feeling better. We have tear nutraceutical supplements, pill you take by mouth that help supplement the tear film called Hydro Eyes. And we even sometimes use microscopic tear plugs that plug up the tear drainage area to keep the tears around longer. But if you have chronic dry eye, you may need one of our high technology treatments.
So that's what I was going to ask you about. What about chronic dry eye?
Yeah, well, and chronic dry eye is most often caused by that oil layer problem, those meibomian glands that aren't secreting oil properly. And our 2 prime treatments are LipiFlow and IPL. LipiFlow gently heats and massages the lids to get those oil glands working again. And IPL uses pulsed light therapy to alter the blood vessels in the skin along the eyelids to help the oil glands work again. And patients that have a condition called rosacea, where they have that kind of redness on the face and maybe some little blood vessels that really shouldn't be on the surface, it'll treat the rosacea and the dry eye all at the same time. And Jane, I'm a dry eye sufferer.
Really?
I've had both treatments done. And first of all, they don't hurt. They're really pretty quick. And they really, really work. In fact, I don't use any tear supplements anymore.
Good for you. Okay, quickly, is it covered by location or by insurance, and how many locations?
Well, insurance unfortunately doesn't cover it at this time. We've negotiated with the manufacturers and really got the price down so most of our dry eye patients can take advantage of this, and no one's ever told me that they didn't think it was well worth it. And of course, we have locations all over the Metroplex. We have 9 locations now.
Okay.
But remember, the tear treatment center or the dry eye treatment center is only at our headquarters office off of 75 North Central between Royal and Forest.
All right, great to see you. LipiFlow and IPL are only available at the Dallas headquarters office. If you suffer from dry eyes, call 214-220-EYES, 214-220-3937 today to set up an appointment, or just go to keywhitman.com for more information.